right? Alcohol, the same thing. Okay, surge of dopamine. So, and what happens is that with time, people that are hijacking their dopamine system with chemicals that are not right, is that the dopamine starts to deplete from the brain. The brain knows that this is not right, that this dopamine that's coming is coming at the wrong time, the wrong amount, something's not wrong, and the brain starts to stop making dopamine. Right? So in the upper left is a normal brain, the red is the dopamine in the brain. The lower left is a cocaine addict. Right? The dopamine is gone. The lower right is an alcoholic. Most of the dopamine is gone. There's very little dopamine left. The upper right is an obese person. There's no dopamine. There's no dopamine. We're gonna. Why is that? We're gonna get to that. Okay. So not only does a person who is obese have multiple hormones that are messed up, neurotransmitters that are messed up, not enough dopamine, not enough serotonin, but they also have their obesity prevention mechanisms in their body are screwed up and not working. You know that your body has mechanisms in it to prevent you from becoming overweight. It's in the design of you as a human being. One of them is leptin. Leptin is a protein that's made by your fat cells if they have too much fat in them. And the leptin gets into your bloodstream and it goes to your brain, and it's supposed to make you stop eating. Right? And they've tried to create obesity in a number of people. Right? And some people, they can make them obese by making them eat. Some people you can't even create it. You can't do it. They won't do it. Right? And the reason is leptin. Leptin gets in the bloodstream, it goes to the part of the hypothalamus that controls appetite, and it turns the appetite off. The problem is, we have found in the last decade, is that people who have obesity have leptin receptors that don't bind to leptin very well. So the leptin is not turning off their appetite. It's because of abnormal leptin receptors. So not only do obese people have not enough of multiple hormones, not enough of neurotransmitters, but also their prevention mechanisms don't work. Right? So a lot of things have to go wrong to get this heavy. Right? Do you get that? Are you getting it? Okay. All right, that's just an exercise. Okay. So now, here's the thing that goes right in people that are heavy. Unfortunately, what things have to go wrong? Okay. So this is 13 people that they put in the hospital, and they put IVs in them, and they drew their blood every hour. And at 6 a.m. they drew the blood, and they're checking a hormone called ghrelin. All right, everybody say ghrelin. Ghrelin. Right? Ghrelin's a hunger hormone. Ghrelin makes you feel hungry. If anybody feel hungry right now? Anybody feel hungry? You feel hungry? All right, me too. I feel hungry. So ghrelin is what makes you feel hungry. What's happening is that your brain has got ghrelin washing it, saying, eat, you're hungry, eat. Okay? So they check the ghrelin at 6 a.m., 7 a.m., 8 a.m., they check the ghrelin level, it's going up, and then they fed everybody breakfast. And then what happens is that the ghrelin goes down. Has anybody noticed that after you eat, you're not hungry? Yes? Okay? So the ghrelin level goes down to about 10, and then it goes up till noontime, and then they fed everybody lunch, and then it goes down, and then it goes up to dinner time. It goes up pretty high. Are you guys hungry? Is it dinner time? Are you? That's what this says. This shows that you're hungry as dinner time. I'm hungry as dinner time. All right? And then it goes down, and then they go to bed at 10, goes up, and then it sort of goes down. All right. Now I'm gonna give a clue right here. It goes down between 10 and midnight because food and sleep cause ghrelin to go down. And when this person is sleeping, the ghrelin goes down. All right? So then they took all these people and they put them on a diet. And they made them all lose 20 to 30 pounds. And they brought them all back. And they checked their ghrelin level again. Same 13 people. The ghrelin level before was about 330, and now it's about 450. Right? What does that mean? What's that? They're hungrier. When are they hungrier? All the time. After losing 20 to 30 pounds, they're hungrier all the time. The ghrelin goes up and then it comes down, but this is the level where they were hungry at before. Goes up to lunch, and even at lunch it doesn't stop going up. It's less responsive to eating than it was before. And then it goes down, and they were still hungry here before, and it goes up and it goes down. So many of my patients have told me, Dr. Chasen, I don't understand what it is. I went on the just most fabulous diet and exercise program. I lost 70 pounds. And then my Uncle Irv died, and the price of soybeans in Saskatchewan went down, and the Seattle Seahawks traded away my favorite defensive back, and I gained all the weight back. I don't get it. No, that's not why you gained the weight back. You gained the weight back because your ghrelin level went up, and you were hungry all the time. Show of hands, who gained weight back after they lost a bunch of weight and felt really discouraged by it? Okay? Guess what, gang? It's not your fault. This is the part of your body that works. The weight loss prevention mechanism. That's not very encouraging, but that's why. That's why you gained the weight back. And that's why diet and exercise programs to lose weight typically end in failure. All right. So, remember we talked about the dopamine, right? It turns out that sweet, which is sugar, salt, sodium chloride, and fat, which is animal fat, oil, things like that. Which, by the way, that's what a McRib sandwich is. Sweet, salty, and fat. Right? That sweet, salty, and fat triggers massive dopamine release, just like cocaine, just like heroin. And so what happens is that people who are obese have their food that they're addicted to, right? Don't tell me what it is. Just close your eyes and think about what it is, that food that you're addicted to. You know what it is, right? And you typically eat it at nighttime. And you eat it in large quantities. It's either sweet, salt, or fat, or in my case, it's all three, right? And that's what's causing your dopamine receptors to decrease. And what happens over time is a condition called anhedonia. And people are eating almost with a sense of panic, trying to feel that euphoria, that rush, right? And they can't get there. And so 2 cookies is 4 cookies, 4 cookies is 6 cookies, 6 cookies is a package of cookies. A package of cookies becomes 2 packs of cookies, right? Before you get that rush. Anybody want to say bullshit? Nobody's going to say bullshit. Okay. I'm not trying to make you feel bad. All right. I am not trying to make you feel bad. All right. So, and people get this condition where they have no pleasure in their life over anything. Let's skip that. Okay. So now, of everything that I've said so far, what have I said that's your fault? Right? Was the fact that you were abused as a child, was that your fault? No. Right? Was the fact that as a child your explanation was wrong, was that your fault? No. Was the fact that your hormones are all screwed up, is that your fault? No. Right? Is the fact that your ghrelin works perfectly, is that your fault? No. Alright? Alright. So everything so far is not your fault except for now. This is your fault. Okay? So, alright, I'm going to name the disease and you tell me the behavior. HIV, herpes virus, chlamydia, and gonorrhea. What's the behavior? I'll cut to the chase. It's promiscuity. It's having sex with a lot of different people. Right? It's not sex. It's not unprotected sex. It's sex with a lot of different people. Okay? Alright. Cirrhosis of the liver, upper GI bleed, alcohol, right? Lung cancer, throat cancer, esophageal cancer, what's the behavior? Smoking, alright? Melanoma, basal cell cancer, squamous cell cancer, being in the sun, gunshot wounds, stab wounds, getting beat up with a baseball bat. What's that? Selling drugs in the corner, right? Right? Right. So do you agree with me that certain behaviors result in certain diseases? Yes? You agree with that? Okay. So now, here's the question I have for you. Can you name at least 2 behaviors, and you get a gold star if you can name 3, that cause obesity, and you can't say overeating and lack of exercise? What's the behavior?